Hello and welcome to our debate for the fall 2018 semester for the ethics class at Ball State University. My name is Julia King. I'm from Phoenix, Arizona. This is my second semester at my third class. I currently work as a therapist in a autism class for our middle school students. And I will be arguing on the con side of gift giving in the field of today. So I will be arguing for the ethics code to stand exactly as it is in regards to gift giving and receiving behavior.
I'm Matt Stam. I'm from Washington, D.C. I started Ball State University in the spring of 2017. I'm currently an ABA therapist for high school students as a 2-to-1. And I will also be arguing on the con side, just like Julia.
Hi, I'm Paige Wilson. I am in Seattle, Washington, and I work as an early intervention therapist. This is my fourth semester at BSU, and I will be arguing on the pro side of it.
Hi, my name is Chris Koenig. I'm from Waldorf, Maryland. This is my third semester at Ball State. I work as a registered behavior technician in-home one-on-one with kids ages 4 to 11, and I will be debating on the pro side, so in favor of gift giving.
Hi, my name is Jessica Hudson. I am in Miami, Florida. This is my third semester at BSU, and I am a supervisor and staff trainer at the organization that I'm with now. And I will be arguing on the pro gift giving side, just like Chris and Paige.
So before we kick off our debate, we wanted to pose to you guys as the viewers a real life situation that one of us has encountered in our practice as ABA therapists, just to get you thinking about it. And we'll give you a whole lot of information on both sides of this debate, and then kind of ask what you guys think is going to be the best reaction to the ethical dilemma that we have come across. So at one of our practices, there was a family who made amazing Chinese food for all of the therapists that worked with their child. And they would bring it, and it was amazing. It was just so many egg rolls, and everybody looked forward to seeing those, trays and trays of egg rolls laid out in the break room. When the clinical director came to the mom, though, and said, look, we really appreciate it. This Chinese food is great. The egg rolls are amazing. But according to our code of ethics, we really cannot receive this gift. We can't, the egg rolls, the Chinese food, it is a gift, and we are ethically bound to actually refuse all the egg rolls, no matter how delicious they are. And after that, the mother no longer brought in any Chinese food, but she also completely separated herself from the services that her son was being provided. When she was allowed to give the food, the gifts, she came to every supervision. She was at, after school meetings. She was very, very involved in his therapy. But after she was told that she could no longer bring in gifts, she absolutely did not come back to the clinic. Her son still attended, but aside from dropping him off and picking him up, she did not have anything to do with his therapy. Later, after a year after she was told that she couldn't bring in the egg rolls, she came to the clinical director for her son's birthday and begged to be able to bring egg rolls to celebrate his birthday. She really, really wanted to, make this gesture to celebrate. And the clinical director just said, okay, we accept, we'll do it. And after that, the mother became completely involved in her son's therapy once again. So we'll leave you with that situation, and without further ado, go ahead and kick off our debate. In their May 2015 newsletter, the Board of Certified Behavior Analysts provided insight to their reasoning in adding a new element to the Code of Ethics, a ban against gift giving and receiving gifts. beginning on January 1st, 2016, they announced that element 1.06D would be added to the code. Behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationship.
While this addition to the code may seem reasonable, in practice it creates a lot of tension between professionals and their clients, which in turn has the potential to damage rapport. Gifts are tokens of appreciation. Clients and their families should be allowed to show gratitude for services rendered by therapists in whatever way they choose. For some, not being allowed to express their appreciation is considered to be very rude. By giving a small gift, it is important to realize it is the gift giver's way of saying thank you and not an attempt to gain more attention from the behavior analyst. It is also important to take the size of the gift into account. While most professionals would agree that a large or costly gift is unethical to give and receive, but in reality, the most common gifts that are given or that are attempted to be given are very small in field. For example, when a client's mother brings food to a team meeting, like the egg rolls, or when a client offers some of the coffee they just brewed, or they give their therapist a $5 gift certificate to a store because they don't shop there. Gift giving is often motivated by seasons or special occasions. For example, Christmas, Hanukkah, Valentine's Day, or the termination of services. This may bring up some sensitive cultural issues related to which holidays a family celebrates and how they celebrate those holidays. In addition, gift giving is a social norm for many holidays. Any parent who has a child in elementary school will tell you that it is almost expected to get their child's teacher a small gift. And it can be really confusing for the parent to understand that you cannot accept a gift, especially if you work in a school setting. Finally, turning down gifts can be incredibly culturally insensitive. For this reason, rejecting a gift can have negative effects on the professional relation between the behavior analyst and their client and the client's family. This in turn can hamper the client's right to effective and therapeutic services. For example, if a parent brings food that is rejected, it could be portrayed as offensive enough for that parent to stop participating in team meetings or communicating with the behavior analyst. In the field of ABA, we spend a lot of time building rapport and trust with the families we work with. A small gift should not be something that interferes with this child's progress.
Despite the fact that element 1.06b already covered that any forms of entering into multiple relationships with clients must be avoided, the board felt that the need to create this additional requirement, specifically referring to gifts, underlining that such gifts can be as small as gift cards and food, or as extensive as vehicles and housing. While this addition to the Code of Ethics may seem culturally insensitive or too harsh a restriction to place on clients and analysts, it only aims to protect both parties from a potentially exploitative relationship where only a professional and therapeutic one should thrive. The practice of giving gifts is incredibly complex, but in reference to applied behavior analysis practitioners, we are arguing that gift giving should be avoided based on the following 4 points. First and foremost, the Board of Certified Behavior Analysts created the Code of Ethics as a complete set of guidelines to govern all of its practitioners in order to protect both the providers and recipients of ABA services. Therefore, it should not be treated as a buffet menu from which analysts and technicians can pick and choose the rules they want to follow. By breaking element 1.06d, practitioners undermine the entire code by creating a slippery slope of which codes should be followed and which can be ignored, fostering an environment where other ethical missteps beyond giving and receiving gifts can thrive. Second, the exchange of gifts can hamper the objectivity of the ABA practitioner who may feel pressured to give preferential treatment to a client after a gift has been given. This preferential treatment could come in the form of allocating more therapy time to the client over others. scheduling more experienced therapists to work with the client versus newer therapists, or improving the general quality of the therapeutic environment for one client in the form of more resources or better materials, while other clients are given a more standardized basis of care. An additional affront to objectivity will stem from gift giving if multiple relationships are formed between the ABA practitioner and the client. The acceptance of small gifts like gift cards or chocolates can encourage larger gifts like housing or transportation and continued interaction with the client and his or her family outside of the therapeutic context. For example, invitations to dinner, birthday parties, or sporting events. Therapists who work directly out of a client's home are particularly susceptible to these types of dual and multiple relationships forming and should take extra care to guard their objectivity, even if it means turning down a gift card to a favorite coffee shop or restaurant. Next, it will be argued by those in favor of gift giving that it can be incredibly culturally insensitive to refuse a gift. However, the myriad of cultural differences when it comes to the practice of gift giving is incredibly dense and complex. For some, it is a simple gesture to make a guest in a home feel welcome, while for others, it actually binds and obligates the gift receiver to the gift giver. ABA practitioners are scholars of behavior, not of cultural anthropology. They should not be expected to be able to interpret what each gift means to each culturally diverse client.
According to the Oxford English Dictionary, the word gift is defined as something the possession of which is transferred to another without the expectation or receipt of an equivalent, a donation, or a present. Motivation for gift giving should be altruistic, meaning nothing should be expected in return. If you were to provide a service for someone and they want to show their gratitude, they should be able to provide a gift that does not hold personal value or is not of high materialistic value. A study done by Gatewood and Driver showed evidence that recipients of gifts showed stronger gratitude when they perceived the giver sincerely expected little or nothing in return. There should be nothing wrong with a family giving a behavioral analyst a gift such as a cheap pencils or pens, a stack of blank printer paper to accommodate for the materials needed to print off behavior data sheets, graphs, and skill acquisition sheets, as long as the intention is altruistic. Gift giving is also something that is related to the release of happy neurochemicals. Gift giving has been scientifically proven to release endorphins and dopamine. These chemicals are linked to your brain's reward system, giving you that happiness feeling. A study conducted by Harborough, Meyer, and Bergotte recorded neural activity of how participants were splitting a $100 bill between themselves and a charity. Results showed that giving in the form of charitable donations is adherently rewarding. The content of the gift should also matter. Gifts should not hold too much personal value to the giver or have a high materialistic value. Previous research by Blake and Early shows patient attitudes about pharmaceutical companies giving gifts to physicians. The study shows that drug samples, medical books, and ballpoint pens were the gifts that received the most approval from patients and clients. Gifts that received the least approval were dinner, baby formula, and cocktail parties. I would agree that these high-value gifts would be very inappropriate and would possibly lead to a multiple relationship where there is obligation tied to it, but small gifts with no motive or have little to no value should be seen as harmless and acceptable.
Behavior analysts are not the only professions that struggle with whether or not to accept client gifts at holidays or in other contexts. In the article, Reflections on Gifts in the Therapeutic Setting, the gift from the patient to therapist, Andrew Solomar, MD, wonders why a patient gives a gift. What does it mean to the patient? Does accepting or denying the gift alter the doctor-patient relationship? He describes how problematic it is to determine and understand the meaning of an individual gift gift-giving exchange. In Lawler, Kuhn, Baker, and Large, in the Mutual Dependence and Gift-Giving and Exchange Relations document, that gift-giving reinforces a mutual relationship and tends to escalate over time, which argues against accepting any gift, no matter how small, because it tends to increase gift-giving. In addition to contriving the gift code, gift-giving contributes to multiple relationships, which is prohibited. A sense of obligation can be incredibly powerful. Once the gift-giving has been established, breaking that cycle can result in some feeling that they are no longer cared for or liked. There are so many potential entanglements and complexities in trying to adapt gift-giving norms to individual situations. That is far better to avoid gift-giving in any form, which is what the BCBA code requires.
The side against behavioral analysts accepting gifts brought up the fact that accepting gifts can lead to multiple relationships. This follows Code 1.06 under the VACB Code of Ethics. The code states that behavioral analysts must seek to resolve any issues that may arise if there is any evidence of a multiple relationship. If this is the case, then behavioral analysts can accept gifts as long as a multiple relationship doesn't occur. When accepting a new client, a behavioral analyst informs parents about the procedures they will be implementing with their child. The behavioral analyst can also include the guidelines the parents must follow, including gift-giving procedures. Parents must be informed that they are not allowed to present the behavioral analyst any personal or high-quality gift. Research has shown that patients of physicians who received gifts from pharmaceutical companies viewed gifts that were personal or high materialistic value, such as coffee makers and dinners, very unfavorably. Patients were most likely to approve drug samples, medical books, and ballpoint pens. Another point brought up was that if a behavioral analyst decides to accept a gift from a client, then they can feel obligated to a client because gift-giving behavior can lead to preferred treatment. Whether a behavioral analyst is receiving a gift or not, there should be no preferred treatment or views towards other clients. Gift-giving behavior should be seen as an altruistic trait and that nothing should be expected from the receiver of any gift. Behavioral analysts should be able to accept materialistic gifts of low value from clients without judgment to that client or onto others. Behavioral analysts should never expect gifts from clients, but should be allowed to accept the gratitude a parent or client wants to show for the work a behavioral analyst does by bestowing a gift. Some concerns come to mind if a behavioral analyst is required to deny all gifts from parents and clients. What happens when you have rejected a gift from an emotionally fragile parent or have said no to a client who only wants to give you some colorful stickers? What if this scenario happens with your client that you have been working on increasing social skills such as sharing, compassion, and perspective? You could be reversing any progress you have made, as well as losing the trust of your client. Social rejection can also lead to increased aggression in some clients.
In response to the statement that the code is a complete code for behavior analysts, not a buffet table of rules to choose from, the Code of Ethics written by the board leaves much to be desired in terms of specificity of the definition, multiple relationships should be defined as well as what constitutes a gift. Let's say a family has been with the clinic for 3 years and is now moving out of state. The client has had life-changing breakthroughs and that has changed the quality of life for the whole family. So on their last day, they drop off a thank you card with a plate of cookies to the clinic as a small gesture to show their appreciation. Is this common social gesture considered gift-giving? How does this automatically constitute a multiple relationship? Part D. of Code 1.06. Feeling obligated to a client because of a gift can lead to preferential treatment, was Paige's argument. And my response to that is that behavior analysts are shaped to view situations rather objectively. Saying that a gift can lead to preferential treatment is the same as saying that a client with aggressive behaviors or non-involved behavior by parents can lead to less preferred treatment. In response to gift-giving behavior leading to multiple relationships, which can be harmful for the client and therapist alike, multiple relationships should be better of ethics. If a parent gives a therapist a goodie bag with candy and a scarf in it for Christmas, but they never speak outside of therapy hours, aside from occasional discussions about schedule changes, does that constitute a multiple relationship? There are certainly ways to give and receive reasonable gifts and still remain professional. The diversity of multicultural gift-giving and receiving traditions are far too complex for a therapist to be expected to navigate for each instance of gift-giving behavior, but social norms can be considered in those moments.
Those arguing in favor of gift-giving and receiving behavior have based their stance on 4 main points. 1, that clients have a right to show their appreciation in whichever way they choose. 2, that the value of a gift should be used to determine whether receiving the gift would be an ethical violation. 3, that the contextual or seasonal appropriateness of the gift-giving behavior should determine the ethical nature of the gift-receiving behavior. And 4, that denying a gift could be culturally insensitive and damage the relationship between the client and therapist, ultimately harming the therapeutic environment. In reference to the client's right to express their gratitude for services provided, while the Code of Ethics outlined by the Board of Certified Behavior Analysts outlaws gift-giving and receiving behavior, it does not outlaw gratitude. We argue that more work is simply needed from the standpoint of the therapists and the agency they work for in preparing clients and their families on ways to express gratitude in ways that do not ethically compromise the therapists involved. It may feel presumptuous for a therapist to let a family know they can thank them in the future before services are even rendered. However, a simple conversation during client intake or even a written document in an intake package for a new client could explain that therapists and their supervisors are not able to accept gifts at any point during the time they are providing ABA services. The explanation could specifically reference the code, explaining that by not engaging in gift-giving behaviors, clients and their families are helping practitioners to strive for the highest levels of integrity and ethical excellence in order to better serve their clients and community. This communicative antecedent intervention before the gift-giving behavior has even occurred would help therapists to avoid the uncomfortable consequence of denying a gift after it has already been given. By proposing that ABA practitioners could wait until a gift has already been given and deny or accept it based on its value, the team arguing in favor of relaxed gift-giving restrictions is actually suggesting a far more awkward and potentially damaging denial by the therapist to the gift giver. While accepting a $5 cup of coffee may seem like less of an ethical violation than accepting a $500 iPad, putting a therapist in the position to deny a very valuable gift that a client may have worked very hard to afford could be far more damaging than denying that $5 cup of coffee. Once again, we propose that the antecedent modification of communicating with clients that any gifts, no matter their value, cannot be ethically received by ABA practitioners would be the better intervention than allowing the gift-giving behavior to continue on a case-to-case basis. Such an intervention would also help to keep practitioners ethically compliant during times of the year when gift-giving is seasonally motivated. For example, Christmas, Hanukkah, or Valentine's Day. In addition to initially priming clients and their families to not engage in gift-giving behavior around these times of year, An ABA agency could also provide a template for a heartfelt thank you note if a client and their family would like to fill out one for their therapist. By providing the template, the agency would be removing the pressure to spend money even on a small card. Client feedback forms could even be provided throughout the year where clients could express their concerns or gratitude for any services provided. Finally, while the team in support of relaxing the rules surrounding gift giving argues that refusing gifts can be incredibly culturally insensitive, we maintain that the complexity of different cultures when it comes to gift giving traditions is far too complicated to navigate on a case by case basis. In his blog on business relationships, Neil Payne explains that gift giving from Japanese and Chinese clients is expected to be reciprocated. And in both cultures, expensive gifts are normal and frequently expected. Giftopedia, a website dedicated to explaining gift-giving customs around the world, explains that with Indians, gifts should never be opened in the presence of the gift giver. Italians would be offended by gifts given in uneven numbers, and if the gift was not opened in the presence of the gift giver. Saudi Arabians would never present a gift with their left hand and would be offended if you did so. These sometimes stark and sometimes subtle differences in gift-giving traditions underline the complexity that an ABA practitioner would have to navigate in an already very complicated field. We again suggest better communication between ABA therapists and agencies and their clients before gift giving has even had the chance to occur as an optimal antecedent intervention to decrease gift giving behavior.
The BACV Code of Ethics states that behavior analysts do not accept any gifts from clients because this constitutes a multiple relationship. The term multiple relationship isn't defined in a way that lays down the boundaries for what is or is not acceptable in terms of gift giving. There aren't any examples or non-examples of what constitutes as a gift, which leaves both parents and behavior analysts confused. Let's say a behavior analyst is recording data and their pencil breaks. Is a parent not allowed to give them a new one because it constitutes as a gift? What about when a behavior analyst works in the client's home and uses their bathroom? Is it considered a gift if the parent tells them to try their new scented lotion? What about the soap or the toilet paper? These boundaries need to be clear and precise for both behavior analysts and parents to understand. One thing that can be stated is that gifts that hold a lot of personal value or gifts of high material value should not be given. As discussed before, previous research has shown that patients and doctors view gifts from pharmaceutical companies such as dinner, baby formula, and cocktail parties as inappropriate. They should not be accepted by doctors. Likewise, the gifts such as ballpoint pens, medical books, and drug samples were viewed mostly in favor as appropriate gifts. Gift giving can be heavily motivated around the holiday season, and families should be able to show their appreciation and gratitude for the behavior analysts working with them. Families need to know that gift giving behavior should be seen as altruistic and that nothing should be expected in return. Behavior analysts need to know that they should never feel obligated to a client or feel the need to give preferred treatment when they are given a gift. If a family's quality of life drastically improves because of the work of their analyst and therapy team, it is common in many cultures to want to express that appreciation. Families should be allowed to show their gratitude towards a behavior analyst by providing a gift of low material value and not personal to the family. Denying a token of appreciation may be off-putting to someone who has put a lot of thought and consideration into a gift or who truly feels as though they have no other way to express their gratitude. Denying a gift may do more harm than good. Previous research has shown that social exclusion and rejection can lead to an increase in aggressive behaviors. It is better to accept a small gift, or rather accept a gift and not use it or throw it away, rather than reject a gift and cause a negative consequence. Rejecting a gift could also be disrespecting someone's culture, causing a rift in a relationship, and even potentially result in reduced services for the client because of the damage that was caused by the denial. Perhaps our largest argument is that the conflict that arises from the rejection of a gift can damage the rapport built with the family. This is such an important aspect in the client's treatment, and a small gift should not interfere with the child's progress.
BACB Code 1.06D. Behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes as a multiple relationship. So you should be proactive. Inform the clients at the start that no gifts will be received because the code absolutely forbids it. Be clear about it yourself so you do not stumble or stutter with your clients. You don't want them to feel like you're making exceptions or singling them out in any way that is inappropriate. This and other steps are proposed by Emily McCluch in her article, 3 Things You Can Do Instead of Accepting Gifts from Clients. Another is offer an alternative. In an email alerting the clients about the no gift rule, offer them the opportunity to say something nice or give feedback to you. 3, kind words are appreciated and can be very satisfying for the client and can give the therapist feedback on the services, which in turn can help them improve their professional work. And 4, give them a printed card that explains clearly the reasons why no gift can be accepted. Cite the code sections and go into detail about the slippery slope of multiple relationships. BACB Code 1.06D. Behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes as a multiple relationship. You should also include a no gifts clause in the client/therapist contract. This is a legally binding document on the part of the parties, so any attempt to give a gift can be politely refused based on this contract. The code specifically forbids accepting gifts. As Turner, Fisher, and Loisley say in their article, towards a competency-based, ethical, and socially valid approach to supervision of applied behavior analytic trainees. BABC code and other ethical codes allow for interpretation and professional judgment, but not when it comes to sexual relationships with a client, fabricating data or plagiarizing or accepting gifts.
And that concludes our debate on the ethics of gift giving and receiving behavior in the field of ABA. Now, what we want to do, though, is to hearken you back to the story about the egg rolls. Given all the information that we have just provided, what would you have done? Would you have said that the damage to the relationship with the family when they were not allowed to give gifts was harmful enough? Maybe the code needed to be more for them? Or do ABA practitioners have to follow the ethical code absolutely to the letter, no matter the consequences? We thank you very much for watching our debate. We look forward to hearing your feedback and also to seeing everybody else's debate. We wish everybody a very good luck for the rest of the semester. Have a good day.
Bye.